Good afternoon, this is Glenn Hood. I'm the founder of Big Ear, along with my brother Mark, and today we're going to do a video on making the art of making an impression. And what we're going to do today is we're going to make a full ear impression for any of our Big Ear products. You're going to get a training kit in the mail, and when you get the training kit in the mail, you're going to open it up, you're going to take a look. We're going to talk about just making regular ear impressions today. So you're going to get a product called SantaPress. It is in green in color. It's our Big Ear brand. It's our Big Ear kind of SantaPress. And this is what you're going to use for practicing and making ear impressions. You'll also get probably SantaCast, which is our impression material for making earplugs. So you're going to take the SantaCast, you're going to set that aside today. What you're going to receive is the 3 different bag sizes of Odo blocks. The first size that you're going to receive is the black ones, which are the smalls. These are for small ear canals, and we're going to show you the sizing here in a minute. The second bag that you have is a set of white, which are the medium Odo blocks, which are for medium-sized ear canals. The third set that we have are blue, and these are for the large ear canals. So what we're going to do is we're going to go through the process of making lab-generated products, which would be for the BE1Cs, the BE2s, the No Names, the Oz, all the lab-generated products, musician plugs, and products like this. Today we have a pretty model here in the chair, and how we're going to begin this process is this is the art of making an impression. What we're going to do is we're going to take a look at the ear so that we can size up the size of the ear canal. Now, for demonstration purposes, we're going to use one ear today instead of doing both sides so that we can get in view of the camera. The first thing you will do is, this is actually a technical video on how to make the impressions. You will have already looked at the video on how to fill out the paperwork and do all that first and do our risk assessment first. This is the actual technical portion of making the ear impression. So what we'll do first is we're going to take a look at inside the ear. Instead of using an otoscope to do an otoscopical exam, we're going to use our ear light to be able to do this. So you raise up the ear like this, you take a look down inside, and you can see all the way down into the eardrum. Now again, you raise up on this. Now you don't hurt them, you just get a hold of it like this. You pull out on the ear flap a little bit like this, and then you take a look down inside, and make sure that there's no earwax plugs. You're always going to find earwax of some kind in the ear usually. That's not an aversion to making a set of impressions. The set of impressions will be able to be made like we have discussed before, and you have already taken the test, and that is you know the things to look for when we're doing this. So we're taking a look at Kim's ear here, and it's absolutely clean, perfect for making a set of impressions. And by taking a look at it, my choice is the small, medium, or large, and we're going to go with a small Odo block. So you would do this on both sides, but today we're going to do it just on the one. So we would take the small Odo block, and then again we would raise up on the ear to straighten out the ear canal, place the block in the ear as so, and then just gently slide it down into the ear canal, right to about right there. You okay? Good. Okay, so when we lift up on it, again, we'll do that one more time so you can see this. It's not a poking process, it's kind of just sliding it down the canal. Take this, and we're going to put this into her ear like this, and then gently slide down in. It's going to go down into past the second down, right about there. Now when you let the ear go and you just take a look from the outside, you pretty much can't see what the block looks like. You can see the foam block. The most common mistake that we all make in the beginning is when you're doing this, you kind of watch your face. So back up the camera just a little. You kind of watch your face and you watch for them to wince or make a facial expression. Don't be really deterred by that, but pay attention to it when you're setting that, and just reassure them, make sure they're okay. So the next thing that we're going to do is we're going to take the silicone. You're going to receive your gun, and the gun's going to be like this. And how the gun works is, if you come in a little closer, you push up on the bottom, right here. So you push up with your thumb, you pull the cartridge back like this, pull up on this part here, and you'll have a small little V in it. And the small little V goes to the bottom to go into here. A lot of people already have guns like this, already understand this. And then you close this here, and then push in like this till the material comes all the way up. This cartridge has already been used, So this cartridge will come in. If it was a new cartridge, it would just be in just a little bit. So we'll slide that in like that. We're going to change the tip. And how we change the tip is a little protrusion on the top here, and this little spot goes on here like this. And then the tip will screw on like that. So we're going to change the tip. We're going to put on a fresh tip. Everybody, we care about sanitary processes, so everybody gets a fresh tip. So the next thing we're going to do is we now have the gun ready to go. We're going to have the customer. We're going to get a tissue or a paper towel, and the next thing that we're going to do is we're going to use a bite block. And what this will do is this will open up their jaw to the largest point, so if they're laughing, smiling, it doesn't break a seal. So we're going to have them rest their two front teeth on the very front of this as we make this ear impression. So we're going to come over to the customer, and we're going to have them rest their two front teeth on here, which that'll open their jaw to the largest point, so if they're laughing, smiling, it doesn't break a seal. And then what we're going to do is we're going to give them a drool cloth. And that's just for in case they're drooling. We're in Colorado here, so there's not a lot of drooling that goes on. Then the next thing we do is we take our hand like this, and it's kind of like shooting pole or shooting a firearm. It's the same kind of a stance. You don't pull up on the ear at all. You take this, you take the impression material, bring it up on the gun like this, put it inside the ear, and then just start to squeeze firmly and fill up the inside of the ear. Then as you come around this way, you come up into the top of the ear here, you rotate it around like this, and then that's what you have. Now, normally you would have set the second auto block on the other side, so you would then, because they're in a stool, you would then walk around to the other side, do the exact same thing. Make the ear impression, bring it around, and make sure that the ear is full on the top and the bottom. And this is it. Now, with our impression material, instead of taking 5 to 7 minutes to set up, it sets up in 1 minute and 30 seconds. So there's a serious advantage to using our impression material. If you find that it's curing too quickly, so our room in here is about 72 degrees, so if you find that it's curing too quickly, what you're going to want to do is when we do outside events is put it in a cooler and keep it nice and cool, and then you're able to reach down and grab it, and it's nice and cool. It kind of cools off the person, but it will keep the impression material up around the minute and a half mark. So as we're waiting here, we can almost wait as we're talking through the video because it cures this quickly. So what we're going to do is we're going to have a few different pictures of what good ear impressions look like and what bad ear impressions look like, so that you can take a look at them. Because the number one thing, Travis had me a box, the number one thing is before you go and you put an ear impression in a box, and we want to ship this off to the lab, is we need to make sure that the ear impression itself is perfect, because this is what's going to be our final product. So we have our box here, and when we pull this out here in a minute, you can check this here. Okay, so it's hardening up. Now we don't want the customer to be laughing and carrying on. We pretty much want them to sit pretty still. But as you're doing this at home, you're going to need to do this 4 or 5 times. And like I said, this is the impression for any of the laboratory jetted products that we have. Okay, so it should be just about dry, so you're going to be able to push it like this and be able to feel it. Now, one of the big mistakes that other people make when they're making an ear impression is they'll use a hand mixed material, they'll use a 2-part material, they'll take a syringe and put it in, and then you'll watch them and they'll just push on the ear like this. What that actually does is that actually distorts the ear canal and causes real serious issues with fit. That's why we open the jaw, we do this. So what we do is when you go to take this out, you just get behind the ear like this, and you get a whole little string on the bottom. You pull it out like this, slightly rotate it forward, and pull it out with a string. What we have is an absolutely perfect ear impression. Now, I've been practicing my art for a while, and I got lucky on this one, because sometimes you don't. But what you want to be looking for is shiny spots. So let's say that you see this shiny spot right here. If this shiny spot were up here, that would be a bad impression. Or if the shiny spot was on the back side here. But if you see a little bit of a little void right here while you're making the impression, when it's done, just a little tiny divot on a couple of spots here and there, that's not bad. But this right here, you see the depth of it? The biggest mistake people make is they don't go deep enough. We're just past the second bend right here, which is a perfect depth for any of our products that we make. And there you have this is the art of making a ear impression for any of our custom products. The box. You don't want to have them fill out their name and address, so we're going to go out how to do this. But name, address, and then make sure that you pick up the box and then ask them what their name is, to be able to put the correct impressions in the correct box. Because there's many times that you're going to get 3 or 4 boxes sitting up on the counter, and you want to make sure that you don't take their money, put it in the wrong one, do the same thing to somebody else. That person's now gone. You have no way to be able to rectify that situation. Because that is your responsibility to make sure that you have the right ear impressions in the right name box. So those are our tips for today, and thank you very much for viewing.